Wednesdays is the clinic days for pediatric surgery. On Wednesdays, we start at 8 a.m. And then there's always a case presentation or some learning, teaching kind of presentation from the registrars, house officers. I've gotten a chance to do one as well. I did one on Wilms tumor. And then after that, we go to clinic and then we see a lot of pediatric surgery cases. We're either doing the planning for the surgeries. So we're seeing kids present for the first time, either with an umbilical hernia or an inguinal hernia. I've seen esophageal atresia. We've seen a lot of variety of things. And so we see them there first, then we plan for what labs, what diagnostic tests, etc., before we plan for surgery. Or sometimes it's post-surgery and we're seeing them there as well. And then we do that until clinic ends on Wednesdays. And then I spend the rest of the day, entering data, writing, whatever it is. And then Fridays, I'm also at Home Base National Hospital, and we start at 8:30 with our departmental surgery meeting. So sometimes we have M&M, sometimes we have discharge summaries, sometimes we have case reports. Today, actually, I did a case report. And it was really, really interesting. And so now I'm just waiting for it to be 11 because Fridays we do our ward rounds. So we start at 11 and we just go see the patients who are admitted in the pediatric surgery inpatient unit. And we clerk them, we see their updates, see how they're doing, augment their discharge plans if necessary, augment their plans for stay if necessary. And yeah, that's what it is.
What really solidified why I came to Armenia and honestly why I got into global health in the first place was simply just conversations with my PI, Dr. Shant Shahardemian, and his colleagues, Drs. Lorki Libridian and Kim Hakimian, who have all been involved in global health work, in advocacy in the Ministry of Health here in Armenia for years and have always been people that I've looked up to. And what struck me was how different these conversations were from conversations with my other research teams back in the US, where a lot of the research is focused on improving a very specific technique or a very niche population or refining details within an already established system. But here, they would tell me it might not be as exciting or flashy or innovative, but a lot of the work is just to shape future research and healthcare policy and infrastructure. A lot of moments that I realized even the simple questions had such a profound impact, and that there is something so deeply meaningful about global health research and the power that it has to really make long-term systemic healthcare changes.
As someone who's trying to build their career as a researcher, there were so many concrete things that I was able to learn from this experience, from taking an IRB from start to finish, to working with a broader team, to improving my qualitative methods and analysis skills, and then the dissemination side as well. And I'm really looking forward to continuing to work with everyone again in the future.
I wanted to pick something that I've learned well enough. I've been in Nigeria over the last 4 months. While I've learned a lot of amazing abstract lessons, I've also learned a lot of skills, a lot of physical exam skills, and I wanted to show you something that was new for me. So this item is called a Pinard horn. It is used as a fetal stethoscope. So basically your hair goes here and then the other side goes on the mom's belly, and you're able to listen to the fetal heart rate and compare it to mom's heart rate, see if they're consistent, not consistent. And yeah, you do all of this with an actual stethoscope. Yeah, so this was really cool. I'd never seen anything like it. So this was something that was new for me.